Recently, we had a patient come in with altered mental status and right-sided weakness, and she wasn't able to talk. She was seen in the emergency room, and they did a CT scan. The CT scan was normal. And then they did a CT angiogram, which looks at the blood vessels, and the CT angiogram showed that she had, unfortunately, an occlusion or a blockage of one of the main blood vessels in the brain, the middle cerebral artery. And she subsequently suffered a permanent stroke as a result of that occlusion. Stroke care has come a long way in our country, and I think it's recognized that a stroke is a blockage of blood flow to the brain, much like a heart attack is a blockage of blood flow to the heart muscle. They manifest differently. A patient with a heart attack would have chest pain, maybe arm pain. They would have some vital sign changes. Maybe they get sweaty and nervous. A patient with a stroke would have neurologic deficit that comes on suddenly. All of a sudden, their face is droopy or their arm doesn't work very well. We recognize with heart attack the urgent nature of it because it's life-threatening, and maybe if treated early, a permanent injury to the heart can be prevented. Stroke is the same way. There are some interventions that can be done that can restore blood flow to the brain if given in a timely manner. And it's usually just a few hours is the window that we have. One of the interventions is called TPA, which is a medication that breaks up the blood clot, blocking the blood flow. Another intervention is where the neuroradiologist or neurointerventional physician would go in with a catheter and actually get inside the blood vessel and retrieve the blockage mechanically, called a thrombectomy. So one take-home point is that if a loved one experiences signs or symptoms of stroke, it's to seek urgent medical care to try to treat it before it becomes a permanent injury. The second is, and unfortunately in this case, the patient was outside of that window and suffered a large middle cerebral artery stroke. Patients that have strokes require a lot of care, ICU care, nursing care, physical therapy, occupational therapy, nutrition and dietitian care. The surgeon sometimes gets involved. The neurologist can we figure out why the patient had a stroke in the first place? Can we prevent a second stroke? All of these things come into play, and it's a really good example of interdisciplinary care where lots of people come together to support the patient. And I was actually really quite amazed at the medical care that's provided to these patients by all of the different specialists. And it was a pleasure to work with them as we worked with this particular patient to try to help them through this large middle cerebral artery stroke, which eventually required surgery to alleviate the pressure. Strokes are common, and I just think it's important to recognize this as an acute brain attack, just like a heart attack, where urgent and timely medical attention can make a big difference.